The FDA label for this heart medication lists depression directly as a side effect. It also carries a black box warning, the most serious level, against stopping it suddenly. Yet most people taking it every day have never been told either of those things. There is a medication that millions of people take every day for their heart. It slows the heartbeat down, it reduces the force of each contraction, it lowers blood pressure. For someone with high blood pressure, heart failure, or a history of heart attack, it can be genuinely life-saving. And it works. But there is something that happens inside the brain and the body over months and years of taking this pill. Something that the FDA label lists by name. Something that doctors see in their patients, and that patients feel in themselves, but that almost never gets connected to the medication. That medication is metoprolol, sold under the names Lopressor and Toprol XL. It belongs to a class of drugs called beta blockers, and it is one of the most prescribed cardiovascular medications in the United States, with more than 66 million prescriptions written every year. To understand what metoprolol does and why its effects on mood and energy are so easy to overlook, you need to understand what it is actually blocking. The body produces two stress hormones, adrenaline and noradrenaline. When the heart is under stress, these hormones bind to receptors in the heart muscle and tell it to beat faster and harder. More force, more speed, more output. In an emergency, that response is exactly what is needed. But in someone with high blood pressure or a damaged heart, a heart that is already working too hard, that constant stimulation causes strain. Metoprolol blocks the receptors where those stress hormones land. The hormones are still produced, they still circulate, but they cannot reach the heart as effectively. So the heart slows down, it beats with less force. The pressure it creates against the artery walls drops. For a struggling heart, that reduction in workload is relief. But those same receptors that metoprolol blocks in the heart, beta receptors, exist throughout the body. In the brain, in the muscles, in the cells that produce energy. And when metoprolol blocks them everywhere, not just in the heart, the effects go far beyond heart rate and blood pressure. The FDA label for metoprolol lists fatigue as one of the most common side effects. In clinical trials, approximately 10% of patients taking metoprolol tartrate reported fatigue as a significant side effect. But what the label describes as a clinical side effect, most patients experience as something much more personal. Not fatigue from the medication, fatigue from getting older, fatigue from stress, fatigue from the heart condition itself. The pill is never the explanation that comes to mind, because nobody offered it as a possibility when the prescription was first written. Here is why the fatigue happens at a biological level. The body uses adrenaline to signal muscle tissue to produce energy on demand. When physical activity begins, adrenaline binds to beta receptors in the muscles and the cells that generate fuel, and the output increases. This is how the body powers movement, how it responds to demand. When metoprolol blocks those receptors throughout the body, not just in the heart, that production signal becomes muffled. The muscles receive a quieter message. They produce less energy in response to physical demand, even when the demand is ordinary. Climbing a flight of stairs feels harder than it did 2 years ago. Walking across a parking lot feels like more effort than it should. A task that once felt automatic now requires recovery afterward. And the person experiencing this does not think, "This is my medication." They think, "This is my age. This is my heart condition. This is just how things are now," because no one ever told them to think otherwise. For someone already managing a cardiovascular condition, who has been advised to avoid overexertion, the line between the disease's effect on energy and the medication's effect on energy is nearly impossible to draw without a doctor who thinks to look. Most do not look. If someone you love takes this medication and has been struggling with energy levels or mood that they cannot explain, what comes next is for them. The FDA label goes further than fatigue. It lists depression directly among the side effects of metoprolol. Not low mood as an incidental observation. Depression, listed by name in the prescribing document. Here is why it happens. Beta receptors exist throughout the brain, particularly in the regions that regulate mood, motivation, and the ability to feel engagement with daily life. Adrenaline and noradrenaline are not just emergency stress hormones. They are neurotransmitters, chemicals that carry signals between brain cells and contribute to what might be described as the feeling of being alive to the world. The drive to get up in the morning, the motivation to start a task, the capacity to feel pleasure in small things. These experiences depend in part on the noradrenaline system functioning with its normal level of activity. When metoprolol blocks beta receptors in the brain, the signals that run through that system become quieter. Not absent, quieter, and over weeks and months, that quieting shifts something. Motivation decreases gradually. The things that used to bring a sense of satisfaction produce less of it. The world does not feel painful, it feels slightly less vivid, slightly more flat. Getting out of bed takes more internal effort than it used to. Social engagement feels like more work. These are not the dramatic symptoms of a depressive episode. They are the subtle, accumulating effects of a neurochemical environment that has been altered, slowly, by a medication taken every morning. And they are profoundly easy to miss. A patient on metoprolol who develops these symptoms is frequently prescribed an antidepressant. The antidepressant provides some relief, but the underlying cause, the medication-altering brain chemistry, is never addressed. Months pass. A second medication added for a problem created by the first. The FDA label lists depression. It has always been there. Most patients have never been told to watch for it. The FDA label also carries a black box warning, the most serious level of warning the FDA issues. It states that patients with coronary artery disease face severe risks from abruptly stopping metoprolol. Dangerous increases in heart rate, worsening chest pain, heart attack, dangerous heart rhythms. This is a medication that must be stopped slowly and carefully, under medical supervision, never suddenly, never alone. That warning is at the top of the label. Most patients have never seen it. None of this means metoprolol is the wrong choice. For heart failure, for dangerous arrhythmia, for post-heart attack recovery, it remains one of the most important medications available for protecting the heart. What it means is that fatigue and mood changes in someone on this medication deserve a different kind of attention than they typically receive. They are not automatically explained by aging or stress or the cardiovascular condition. They may have a more specific, more addressable, and more correctable cause. For energy, research and clinical experience commonly support gentle, regular physical activity as one of the most effective strategies for counteracting beta, blocker-induced fatigue over time. The body does adapt. Exercise tolerance can improve even with the medication on board. Timing of the dose is also commonly discussed. Taking metoprolol at night rather than in the morning reduces peak daytime levels and may reduce daytime fatigue for some patients. For mood, research consistently supports omega-3 fatty acids, regular physical activity, and adequate sleep as foundational support for neurochemical balance. Magnesium is commonly discussed in the context of mood support, and many people on cardiovascular medications are low in magnesium without knowing it. If depression symptoms are present and persistent, many doctors now recognize metoprolol as a possible contributing factor and consider whether the dose can be reduced or whether a different beta blocker with less tendency to cross into the brain might produce fewer mood-related effects before adding a second medication. And the questions worth bringing to the next appointment: has my energy changed meaningfully since starting this medication? And is the dose I am on the lowest effective dose for my situation? Have I noticed changes in mood or motivation that I have not mentioned? And could those be related to this pill? Is there a version of this medication that is less likely to affect the brain? Is there a timing adjustment that could reduce daytime fatigue? These questions do not challenge the treatment, they refine it. And a cardiologist who takes them seriously is one worth staying with. Subscribe to Med Truths. Every week we open the label on the medications that millions take without knowing what is inside. Here is the truth about metoprolol. It protects the heart by quieting the signals that push it too hard. It slows everything down. And for a heart under strain, that slowing is necessary and real. But sometimes, for months, for years, it slows down more than just the heart. The energy that used to be there is no longer there. The drive that made mornings feel purposeful becomes harder to access. The emotional fullness that makes daily life feel worth showing up for dims gradually, without drama, without a clear breaking point, without anyone noticing when it started. Those changes are listed in the label. They are real, they are documented, they are not inevitable features of aging or heart disease. They are named side effects of a medication. And when they are named, they can be addressed. That is in the label too. It has always been there. You just needed someone to read it out loud.